Hello, my name is Alyssa Tilley, and I'm pleased to present our work, Improving Cancer Education and Patient Empowerment Through Educational Videos, on behalf of my co-authors today. Low health literacy is a leading cause of treatment abandonment among patients who receive cancer care at Kamuzu Central Hospital in Lilongwe, Malawi. To improve cancer knowledge among patients receiving care in this clinic and to offset the educational responsibilities of the oncology clinical team, we developed comprehensive and culturally appropriate cancer education videos for patients and their families to watch while waiting in clinic. This study took place at Kamuzu Central Hospital Oncology Clinic in Lilongwe, Malawi. Lilongwe is the capital city of Malawi, and Kamuzu Central Hospital is a tertiary referral center that serves the northern and central regions of the country. It has a catchment area of approximately 9 million. In the clinic, there are about 45 patients per week, and 720 new cancer diagnoses are seen each year. The clinic is staffed by both Ministry of Health and UNC Project Malawi employees. We developed educational videos that featured Malawian providers, and these were played in the KCH oncology waiting and infusion rooms. These videos address topics such as disease biology, common myths related to cancer, common diagnostic procedures, treatment, side effects of treatment, and survivorship. This was also accompanied by music videos that attended to specific educational topics about cancer as well. We recruited a convenient sample of participants from the KCH Adult Oncology Clinic, which included patients in the waiting room and in the infusion center. After 6 months of implementation of the cancer education videos playing in the clinic, we compared results from 50 pre- and post-intervention surveys to assess the change in cancer knowledge and general care experience. From the results, the cancer types that were included in the survey included lymphoma, breast cancer, cervical cancer, esophageal cancer, skin cancer, multicentric Castleman disease, leukemia, and multiple myeloma. A majority of participants surveyed were female, and the age ranged from 18 to 79, with a mean age of 42. All but one survey was conducted in Chichewa, the local language. 4 of the 11 questions that were asked were almost always answered correctly, both in the pre- and post-intervention cohorts. These questions included what to do about pain, what to do about hair falling out, and understanding it is a temporary side effect of chemotherapy, the importance of coming to chemotherapy appointments on time, and what to do if the patient has both cancer and HIV. Another 2 of the questions that were usually answered correctly in both pre- and post-intervention assessments included the importance of completing all chemotherapy cycles, even if feeling better and the tumor disappeared, and what to do if they have vomiting at home that prevents the patient from eating or drinking. 2 other questions that were usually answered wrong in both cohorts included what is cancer and the correct diagnostic test for cancer in the brain. For these responses, most participants answered that cancer is an infection and that the test for brain cancer is a tumor biopsy as opposed to a lumbar puncture. The remaining 3 questions showed improvement between the pre- and post-intervention cohorts, with a 5% increase in the percent of patients who answered the question correctly, although this was not statistically significant. These questions included cancer transmission and the frequency of cancer treatment, along with what to do if you are unwell and having fever at home in between chemotherapy treatments. Related to the questions about care experience, the results were overall good. Post-intervention results indicated that more patients felt always listened to by their providers. However, we also noted a higher rate of patient dissatisfaction of care as more patients felt they could not understand chemotherapy counseling. The assessments of video satisfaction indicated that patients found the videos very helpful in terms of understanding their disease and side effects of treatment. They also felt empowered to speak up to their providers following the video intervention. In conclusion, standardized education materials for patients and families that can be reproduced, translated, and feasibly implemented throughout sub-Saharan Africa are urgently needed. Cancer educational videos are a low-cost and feasible way to educate and empower cancer patients in resource-constrained settings, although in-person discussions between patients and providers remain a crucial part of cancer care. Thank you.